Let's consider the construct validity of a physical state, like a mental health diagnosis. For most of these, we don't have a blood test or a DNA test or a brain scan that would reliably diagnose such a condition. So we need to critique how we are measuring that construct. Now, we could ask somebody, do you have a medical condition? Have you been diagnosed with schizophrenia or attention deficit hyperactivity disorder? And we would be getting self-report of their perception of whether they have that diagnosis or not. It's not terrible, but we might miss a whole bunch of people who actually have the diagnosis and aren't aware of it or don't want to tell us about it. We could use observation, and we could observe the archives that are relevant to that. So in this case, the archives would be your medical records. We could get permission and go and ask the doctors, have you diagnosed this person with a mental health disorder, and observe those medical records and see if they have been to a doctor and sought treatment. But again, that's not quite getting at that underlying construct. It is perfectly possible that there are people with mental health diagnoses who haven't sought treatment, so who don't have the archive of their medical record to be observed. Probably the best way of measuring that construct would be to monitor it as directly as we possibly can. And like we said, there's no blood test, there's no brain scan, but we have a standard diagnosis. And so the most valid way of assessing that construct would be to have a doctor perform a full diagnosis with a clinical interview or whatever the diagnosis includes. And we would then know of the participants in our study which ones our doctor diagnosed with a mental disorder and which ones he diagnosed without a mental disorder.